Hello, everyone. I'm Dr. Kalyan Dandella. I'm the Chief Medical Officer for Associated Behavioral Healthcare. I'm going to talk to you a little bit today about treatment options for major depression, specifically a modality of treatment that's been around for well over a decade, FDA approved, called NeuroStar TMS. So let's talk about what we're going to cover today. We're talking about major depression, unmet medical needs, the current treatment landscape, how it is right now, and where we could do a better job of the current treatment modalities. And we'll talk about NeuroStar Advanced Therapy, a unique mechanism of action. It's, like I said, FDA approved with a strong evidence for efficacy and safety, and a mainstream treatment option, and the advantage of NeuroStar versus other treatment modalities. So just looking at the demographics, right out of the chute, you have 3 out of 5 major depressive patients treated through medication are underserved. So what does that mean? Right now, you have about 13.3 million adults in the U.S. that have major depressive disorder. Out of that, 7.6 million people are treated for depression, of which 5.5 million are poorly served. So that means either they lack efficacy in their treatment or they have intolerable side effects. And also to note, that number will be a lot higher if we say the current standard right now is to say, is someone functional with treatment? And being functional with treatment is really not an acceptable treatment modality if you think about it, because it's not a great quality of life. So the impact of untreated depression. There's an excessive amount of use of healthcare resources when depression goes untreated. People come in wanting to address chest pain, backache, chronic pain issues, and so this excessively utilizes healthcare resources. So the indirect and direct costs to our medical system and our healthcare system gets ballooned up significantly as a result of not addressing depression. 30% of depressed patients attempt suicide. Let's think about that and say nearly half of them complete suicide. So that's 19,000 deaths a year in the US. That's a very significant number that we cannot ignore. This is a very important slide. This slide exemplifies a 2007 STAR*D trial where basically, drug companies are coming up with an antidepressant after their patent runs out, right? We typically know this. They change the isomer and they say, oh, well, this one has less sedative effects, whatever it is. Let's be honest, the reality is there is a financial gain to have a patent and to have a runway for each of those new antidepressants that comes out. So looking at the STAR*D trial, what did it show? First line of treatment, first antidepressant that you take, even that is only a 27.5% chance of remission rate, right? So by the time you get to your second or third, you're down to less than 7% chance of going into remission from depression. And the more trials you have, patients often discontinue meds, whether it be because they are tired of trying one med after another or due to side effects. So current landscape, what happens? Most people, when they present with depression, they're going to present at their primary care doctor's office, right? That's where the initial diagnosis is usually made. The primary care doctor will try an SSRI, then maybe an SNRI or NDRI, which is like Wellbutrin. And once they've failed on a couple, they will probably go to a psychiatrist for potentially saying, well, have we gotten the right diagnosis? Is there more psychotherapy? Are there other new treatment options? And right now, what we do typically in the average psychiatric practice is we try some atypical antipsychotics as a combination augmentation or a mood stabilizer with the antidepressants. We might try the MAOIs or tricyclic antidepressants, and the last ditch effort is ACT. So that's the typical landscape right now. Talk about the science of TMS, how that works. TMS stands for transcranial magnetic stimulation, by the way. So treating the brain. When we want to treat the brain, and you look at potentially where depression affects the brain, it's not one local area, right? You're having actually a communication of serotonin being released and communicating with that front part of the front part of your lobe called the prefrontal cortex. And that's where a memory, a good, happy thought is gelled for a patient. They go, okay, you know what? I can go back to this moment and think about it. For a non-depressed person, they solidify sight, smell, sounds, all these things that are happy and pleasurable. They remember them, right? And for a depressed person, whether it be due to past trauma or genetics, whatever it is, this prefrontal cortex, it's underactivated. It's not going to function the way it should. That's why people with depression may have some pleasure in that mid part of their brain and experience pleasure, but it's very momentary. It can lapse, right? They haven't connected again with that serotonin going to the front and coming back from the front of the brain saying, remember this, so you can reflect on last summer or your experience from a few years ago and still live in that happiness. So brain activity can be altered biochemically with medications or electrically. Well, I hate to use the term electrically, or more magnetically, right, with transcranial magnetic stimulation. There's a reason why we take in electrolytes into our body. Usually cells are kind of negatively charged and the outside of cells are positively charged. So when you want to have an action potential, or the cell to say release some serotonin, that neuron to release serotonin, that neuron has to be positively charged. And that's what TMS does. It allows that depolarization of those neurons to say, all right, release that serotonin. This is very important and effective compared to the typical way of how antidepressants, which basically allows serotonin to just stay in between the synapses, the area where it needs to communicate with the front part of the brain. Now, think about that. If you're synthetically doing this with a medication, what are you doing? You're saying, go ahead and stay in a certain area and be there all the time while you're taking this medication. That's not natural. When you have a happy moment, you're supposed to release the serotonin. It's supposed to go communicate with the other structures in the brain and then be taken back up so it doesn't get degraded and excreted out. That's why typically most antidepressants stop working after 7 years, unlike what we're going to do here with transcranial magnetic stimulation, right? So again, neurons are electrochemical cells, and they respond either to electrical or chemical stimulation. And the pulsed magnetic fields from NeuroStar, they induce that electrical current, they depolarize those neurons, get them excited, and say, hey, release serotonin. It's like exercising your muscles, right? So if these dormant neurons haven't been activated for a while and we start activating them, they realize, okay, this is our function, this is what we need to do. And they learn this memory, and in moments of happiness and joy, that serotonin is released, communicates with the front part of your brain, and gets taken back up in. You're tapping into your brain's natural serotonin release mechanism. So there's nothing that's lost. It's actually much more, for long-term efficacy, if you think about that, it's more viable to retain more serotonin through TMS, through NeuroStar, than it is just by giving antidepressants, which, again, can deplete serotonin in the long run. So again, this is another picture showing that depolarization and that left lateral prefrontal dorsolateral cortex, right? So that's the area of the brain that we know is very specific towards depression. And once that depolarization happens, those deeper structures, they communicate with serotonin flow, and dopamine is released when serotonin acts in the mid part of the brain. So that pathway, think of it very much like if you had a clogged water pipe and you have a whole bunch of sludge in it. You can put all the water you want in it, you're only going to get a trickle on the other side. Now you're getting rid of that clog, that inability for that pathway to work, and you have a smooth flow of serotonin from deeper structures to the prefrontal cortex. There we go. And here's a slide here that shows that activation of the left side of your brain saying, okay, there's communication from the dorsolateral prefrontal cortex to those deeper structures. And so repeated activation of the left prefrontal cortex is known to produce antidepressant effects. And like we've seen in the previous slide, and like we're looking at the neuroimaging studies right here, the documented changes in functional connectivity between tissue directly stimulated by NeuroStar Advanced Therapy System. And again, the deeper brain regions known to be involved in mood regulations are now being shown up and lighted up. So here's a picture here of the NeuroStar Advanced Therapy System. Compared to other transcranial magnetic stimulation systems, NeuroStar TMS, look at it, it's very focalized. It's sitting on this lady's left side of her head there, specifically the area we want to target for depression. So as opposed to some other systems that might be more diffuse in their action and have more adverse side effects. So what is NeuroStar TMS? It's non-invasive. There's no anesthesia or sedation. It is not ECT. It is not shock treatment. When ECT and shock treatment, what you're doing is you're putting a person in sedation and causing a seizure in the brain. You are not doing that with transcranial magnetic stimulation. It's very focalized treatment to where we know mood is regulated, specifically with depression. It's an outpatient procedure. It's easily performed in a physician's office. It's about 3,000 pulses that are delivered per treatment session, and it's daily for 4 to 6 weeks in duration, with a 3-week taper after that. And typical duration is anywhere from 19 to 37 minutes. More so than not, more closer to 19 minutes these days. So what happens during that time period? You have a number of pulses that are delivered. You get 10 pulses over 40 seconds. Then you get an 11 to 26 second break. And again, the number of pulses are around 3,000 pulses per session. And it's at an intensity of 120% of motor threshold. What does that mean? So that typically means we use the motor cortex or a region of the brain to say, all right, how much stimulation do you need to get a slight little movement in around the thumb to locate the region, go 5.5 centimeters forward, and whatever the minimum amount of intensity you need to cause an activation of showing that little thumb movement, you want to treat at 120%. And this was not done arbitrarily. It was done through research and studies on why at 120%. And NeuroStar Advanced Therapy is the first FDA cleared less than 19-minute treatment for depression, by the way, as well. So there's a proven efficacy demonstrated through 2 randomized controlled trials. I won't talk to the slide. I think it's pretty self-explanatory. If you take a look at the picture there itself, you can reference that. So overview for safety. There is about a less than 5% discontinuation rate due to adverse events. Most common adverse events are typically pain, localized discomfort in around the treatment area. It's been typically around by treatments 3 or 5 that discomfort usually goes away for most patients, and ibuprofen, Tylenol pre-treatment usually helps a lot with that. For our practice specifically, our biggest challenge is week 2 of patients falling asleep during treatment. We can't let them fall asleep. They can't go into REM sleep for those neurons to get activated and stimulated and cause depolarization. So I'm telling you that to let you know this discomfort and the treatment area is very transient and is very tolerable. So there's no systemic side effects, no adverse effect on cognition. A patient did ask me, well, will I get brain cancer from this? You know, you're sending me. So no, in general, transcranial magnetic stimulation's actually been around since 1985. It's an MRI-based magnet. It is very safe in that aspect. So one of the more severe side effects is the rare risk of a seizure with TMS. So no seizures have been reported during NeuroStar clinical trials of 10,000 treatments. We have all NeuroStar TMS treatments in all of our locations here at Associated Behavioral Health Care. So in general, when we say TMS has a risk of seizure, we are talking about other systems more so than not, right? So that's because they're not focal like NeuroStar TMS, and that's why specifically we chose NeuroStar TMS for safety standpoint of what we want to deliver the highest quality of care. So approximately 1.6 million treatments to date, post-marketing experience. There's a long-term safety demonstrated in 6 months follow-up as well. All right, remission is possible with NeuroStar TMS. 1 in 2 patients respond, 1 in 3 patients achieve remission according to the NeuroStar trials. You can see there as far as remission rates, you have, I think, a third of them going into remission. We are doing a little bit better in our practice. In fairness to NeuroStar, I think they had to be washed off of all meds. We can actually bring a patient down from 3-4 antidepressants down to 1 medication, or from 1 medication to none is what we're doing in our practice. And we're hitting it around 41.7% as far as remission rate, and 95% of our patients are showing improvement at 50% reduction in their depression rating scales. So consistent response and remission rate across the board range of treatment resistance, right? So I think this slide speaks a little bit more to the previous slide as well, a little bit more in depth. Don't get lost in the numbers. Again, the biggest thing you need to know is the remission rate trumps even a first-line trial of an antidepressant. And we're doing very, very well with regards to putting people in remission and having a clinical response. More data. So even over 12 months, you look at it and say 68% of patients maintained a response, 45% maintained remission. That's fantastic. This is a really big deal in the field of psychiatry overall, in my opinion, because we've been stuck in a non-progressive method of medications. This is a interventional treatment for depression that is very progressive with much less side effects. If you talk to most psychiatrists for themselves and their families, they would say, put me in the TMS first. Don't get me on the antidepressants. Long-term phase results at 12 months. Again, more data. I'm not going to bore you guys with the numbers. I think you're looking at it. It's, again, very consistent at that 45% remission. All right, areas of research. So this is a very exciting slide, actually. What we can get at is right now it's FDA approved for depression. We are treating off-label for generalized anxiety and seeing very good results. There's a ton of data coming out for PTSD, anxiety, even schizophrenia, for auditory hallucinations, addiction, tinnitus, and pain. So what I'm getting at is this is definitely the future of psychiatry. This is a way to intervene in the brain without, in a very natural way, and tap into our natural resource of neurochemicals instead of synthetically trying to do things with medications that are potentially toxic to your liver and cause a skew and myriad of side effects. All right, NeuroStar, standard of care for MDD, U.S. Agency of Healthcare and Research and Quality. This slide basically is speaking a little bit more to most insurances. Actually, I can't think of a single insurance that doesn't accept or cover TMS. And today is May 14th, 2018. It is actually a very big day for Centers for Medicare and Medicaid. CMS has announced today that they're actually going to allow TMS to be approved after just 1 medication failure or 2 side effects to any medications. And whatever Medicare does, obviously commercial payers will go ahead and follow in suit. So what I'm getting at is TMS is going to be a second-line treatment and hopefully first-line treatment in the years to come. So NeuroStar Advanced Therapy is indicated for the treatment of major depressive disorder in adult patients who have failed and received satisfactory improvement from prior antidepressant medication in the current episode.